I'm Shelby Vandeberghe, and today I'll be doing therapeutic massage. My patient's complaint is pain in the right interscapular region in what I think will probably be an active trigger point. So what I'll start by doing is just doing the basic therapeutic massage, and then once I find that trigger point, I can do some trigger point release on the spot. The purpose of my therapeutic massage today will be to decrease their pain and improve tissue mobility in the area. Alright, so we have the patient in prone towards the side of the bed of treatment while still maintaining the face in the cutout. I've draped the patient appropriately, pillowed for comfort on the feet, making sure that everything's covered except the treatment area that's exposed. I've already screened the patient for all the contraindications. So now I'll check the skin, check for sensation. Can you feel this? Good. So then now I will use an alcohol swab to clean the skin. And now I'll go wash my hands. For this treatment, I'll be using massage cream, a small amount, but adequate enough for the treatment area. I'm going to start with some superficial effleurage. And what this does is spreads the lubricant around, helps me assess the skin, look for possible trigger points. And then I'll go a little bit deeper effleurage. I'm not able to locate any trigger points just yet, so what I can do is proceed with some petrissage, which is just sort of a kneading of the skin. And I did notice her guard a little bit right here, and I did find a trigger point, so at this point I can find that area and start my trigger point release. Now that I've located the trigger point, I'm going to wipe off some of the lubricant. Some sources say to keep the lubricant, others say to take it off. I just find personally that it's easier for me to do the treatment with less lubricant there. So I found the trigger point, and what I'm doing is just circular motions with my finger, not moving the finger at all over the skin, making sure my DIPs are staying flexed. This type of treatment is known to be slightly painful during the treatment, so I'll let the patient know that. They may possibly even experience some radiating symptoms. I'll do the treatment for 1 to 5 minutes, and the amount of pressure that I'm going to be doing is just as long as the patient can tolerate it. I can go as deep as I need to. So now that I've finished the trigger point release for about 1 to 5 minutes, I'll go back to doing some deep effleurage. I'm going to end my treatment with some superficial effleurage. And once that's done, I'll take some alcohol to dry the skin and clean off all the lubricant. That will complete my treatment. My total treatment time was about 15 minutes, so now that this treatment is complete, the patient can expect a dulling or numbing effect from the trigger point release on that area.